What if the problem isn't laziness, lack of motivation, or poor discipline, but something happening inside the brain that many people miss for years? ADHD stands for Attention Deficit Hyperactivity Disorder. It is a condition that affects attention, concentration, impulse control, and sometimes activity levels. ADHD can affect both children and adults. Many people think ADHD only means being hyper, but it can present in different ways. Some people mainly struggle with inattention, some with hyperactivity and impulsivity, and others have a combination of both. So when should ADHD be suspected? ADHD may be considered when symptoms are persistent, affect more than one area of life such as home, school, work, or relationships, and cause noticeable difficulties in daily functioning. In children, signs may include difficulty concentrating, frequently losing things, forgetting instructions, being easily distracted, excessive talking, difficulty sitting still, interrupting others, acting without thinking, or struggling to wait their turn. In adults, ADHD can sometimes look different. Symptoms may include poor organization, difficulty finishing tasks, procrastination, forgetfulness, frequently losing items, restlessness, impulsive decisions, difficulty managing time, and problems with focus at work or study. Some people describe it as feeling like their brain is constantly busy or jumping from one thought to another. ADHD symptoms usually start in childhood, even if diagnosis happens later in life. Doctors also consider other possible causes because symptoms can overlap with anxiety, depression, sleep problems, autism, stress, learning difficulties, thyroid conditions, and sometimes medication effects. ADHD cannot be diagnosed with a blood test or brain scan. Diagnosis is usually made after a detailed assessment by specialists. This may include questions about symptoms, childhood history, school or work performance, family history, and how symptoms affect daily life. Information from parents, teachers, partners, or relatives may sometimes help. Treatment depends on age, symptom severity, and individual needs. Non-medication support may include education, behavioral strategies, organizational skills training, school support, workplace adjustments, and psychological support. Medication may also be used. Common treatments include stimulant medicines such as methylphenidate and lisdexamfetamine. Non-stimulant options include atomoxetine and guanfacine. Treatment aims to improve concentration, reduce impulsivity, and help daily functioning. One challenge in the UK is waiting time for assessment. There is no single NHS waiting period, and it can vary depending on location and service availability. Some people may wait months, while others may wait much longer. If symptoms are affecting school, work, relationships, or everyday life, it is worth discussing with a healthcare professional early.